We'll just wait one more minute while folks are still signing on. All right, Kathleen, should we get started?
Let's do it.
Okay. Hi, everyone. Thanks so much for joining us. I'm Dr. Cindy Morris, and I'm the Clinical Director at the Behavioral Health and Wellness Program at the University of Colorado Anschutz Medical Campus.
And I'm Kathleen Morera. I'm a Clinical Associate with the Behavioral Health and Wellness Program, and we are so excited to be with you today.
And just to give you a little bit more information about our program, BHWP is a whole health program, and we work with organizations across the US. And one of our aspects includes our motivational interviewing, or MI Institute, where we train interdisciplinary healthcare providers and other professionals to use specific skills and strategies to help people change their behaviors. And we've also worked for many years to apply MI to vaccine hesitancy in relation to youth vaccinations. And over the last year and a half, we have applied our experience to COVID-19 vaccine hesitancy.
Our COVID-19 vaccine hesitancy initiative is called Protect Me, You, Us. And this project emphasizes personal responsibility to protect oneself, your family, and your community. Today, we will be sharing some strategies with you to help you have more effective conversations with people who are vaccine hesitant. And our goal is for you to use these strategies to create interactions that balance personal freedoms and individual choice with our responsibility to protect everyone's health. And we will also address some concerns shared by at-risk populations. This project is a collaboration between the Rocky Mountain Prevention Research Center and the Colorado School of Public Health, the Colorado Department of Public Health and Environment, and the Behavioral Health and Wellness Program. So just to let you know, we will go all the way through our presentation and leave time for questions at the end. So please put those in the chat or you can jot them down. And our presentation, including time for questions, will conclude at 1 p.m. We'll be sharing a video with you, and in this video, we'll be showing interactions with healthcare provider talking with patients. However, for those of you who are community champions, ambassadors, or connectors, focus on how you can apply those same MI skills and strategies for vaccine hesitancy with the folks that you serve. All right, so we just want to make sure everybody's on the same page. Vaccine hesitancy is defined as the reluctance or refusal to vaccinate despite the availability of vaccines. And of course, this is not new. Vaccine hesitancy has been around as long as we've had vaccines. And although vaccinations are the most cost-effective and successful interventions known, there are many people who are still ambivalent. about vaccination or just refuse them. And the concerning thing is that many of these people are already disadvantaged by nature of their race or ethnicity, their income, their occupation, housing, socioeconomic condition, or other contributing factors. And so what are those factors that contribute to vaccine hesitancy, and how do we use that information to address vaccine hesitancy? Well, first and most importantly, we need to consider how people think and what they feel. What are their perceived risks? What is affecting their level of confidence or trust or safety? And we also need to consider societal processes. What are the healthcare providers recommending? What are they seeing in their community? What are those greater societal, racial, or gender norms? And outside of values, fears, or norms, there are also valid concerns and real barriers to vaccination. These are not routine circumstances. Health disparities, implicit bias, and systemic racism is very real. We also know, and I'm sure you all have heard, various expressed emotions, concerns, and skepticism that gets communicated through your neighborhoods, your communities, and peer groups. And these feelings, these fears, these emotions get amplified through social media, which, as we know, can disseminate any perspective or fact, true or false. And then finally, there are practical issues, including that concern about side effects, the convenience, perceived cost, quality, service quality, and satisfaction. So this slide here, you will see listed some specific concerns that I'm sure have been shared with you all over and over again. And in the video that we created, we will show you some ways to talk with folks to address these very specific concerns. So with vaccines that are FDA approved, research has shown that a presumptive recommendation is effective in the context of childhood and adolescent vaccinations. However, with the COVID-19 vaccine, which was only approved for emergency use, a normative collaborative approach that stressed evidence and personal choice had been recommended instead. But now that Pfizer has received FDA approval and the other COVID-19 vaccines are sure to follow here anytime, we will transition to that presumptive approach.
And there's a 3-step evidence-based process to maximize vaccine acceptance. Step 1 is assess disposition. Step 2, use MI to talk it out. And step 3, make a plan. We'll discuss these one at a time and then watch a video that we created to demonstrate each of these steps. In step 1, we want to assess a person's disposition. We want to know, are they an acceptor, a cautious acceptor, hesitant, or a refuser? And based on their disposition, we'll start a dialogue that communicates partnership through curiosity, active listening, and understanding their unique individual concerns. And if someone's an acceptor, there's no real conversation that's really needed. We need to help just support them to get vaccinated. Then with cautious acceptors, these are people who might have some questions or want some more information to really confirm that they want to take the COVID-19 vaccine. Then there are people who are hesitant. And with these folks, you'll want to engage them in a dialogue about their concerns, align their values and priorities with getting vaccinated, and evoke their motivation to accept a vaccination. And with people who are firm in their stance against taking the COVID-19 vaccine, your priority is really to invite an ongoing dialogue about vaccination. Right.
Oh.
And depending on disposition, your conversation will look different. Let's see what this looks like in our video. I'm going to go ahead and share that.
Now let's meet some patients, Teresa, Cal, and Aaron, as they talk with their provider, Dr. Kelly, who asks them about their interest in getting the COVID-19 vaccine.
Hello, Teresa. Thanks for coming in.
Well, thanks for seeing me.
So your thyroid tests are back, and I think we may have an answer as to why you've been so tired lately. I'd like to review your results and go over your options. But first, I wanted to check in on the COVID-19 vaccine. Have you gotten vaccinated yet?
Well, I haven't had a chance to even think about it. It's been so busy. It's so stressful for me now.
You've been so busy and so stressed you haven't had time to even think about it.
That's right. It's been hard enough for me to get here today. I had to take 2 buses and I was just about to miss the second one. I almost didn't make it.
It took a lot of effort for you to make it to our appointment today. I know it's not easy to get here by bus. You're obviously committed to your health, and I really appreciate your effort.
Yes, I'm on the buses all the time and it's very exhausting, but I don't have any other choice.
Well, I certainly understand. Well, since you haven't had time to think about it on your own, would it be okay with you if we take a few minutes right now to talk about the COVID-19 vaccine?
Oh, sure.
What are your thoughts about getting the vaccine?
Doctor, if you could give it to me today, I'd take it. I really worry about getting the COVID-19 and bring it to my family. But I'm out there all the time, taking buses, cleaning rooms at the hotel, going to the grocery store, everything. I wear 2 masks. I wash my hands all the time. They're so dry. But I worry at night that I'm going to get sick, bring the virus to my family.
Now that we've heard from Teresa, what do you think is her disposition? Is she an acceptor, cautious acceptor, hesitant, or a refuser? Take a moment to consider your assessment. She's a cautious acceptor because she doesn't have any internal conflict about getting the vaccine. Her concerns are logistical. Before Dr. Kelly engaged in this conversation with her, she may have looked like she was hesitant. She says she hasn't thought about the vaccine, and her presentation of being stressed and irritated could be taken in error as a sign of being hesitant or a refuser. Now let's meet Cal.
Hello, Mr. Wilson.
Please call me Cal.
Nice to see you today, Cal. I know you're here to talk about your blood pressure, but before we get into that, I'd like to ask, have you gotten your COVID-19 vaccine yet?
No, not yet.
Well, because you have 2 chronic health conditions, AFib and hypertension, you're at a greater risk of developing a severe case of COVID-19. Additionally, African Americans carry a higher risk of having a severe case of COVID-19. What are your thoughts about getting vaccinated?
To be honest, I'm not sure that I'm ready to take the vaccine now. I may want to wait a while and see how things play out. Who knows if the vaccine is even safe?
So you want to see how others do on the vaccine before you take it. You're not quite ready yet.
Yes, I don't think so.
What do you think about Cal's disposition? Is he an acceptor, cautious acceptor, hesitant, or a refuser? Consider your assessment. He's hesitant. We hear very clearly from him that he's been thinking about the vaccine and has some concerns about vaccine safety. Let's see what's going on for Aaron.
Hello, Aaron. It's good to see you again. How are you doing?
Oh, it's all right. Yeah, I'm okay. Yeah, all things considered.
So I know you're here to talk about your asthma and to refill your prescriptions. But before we get into that, I just wanted to find out about the COVID-19 vaccine. I know during your last visit, you said you did not plan on getting vaccinated. What are your thoughts now that the vaccine is available?
I don't know. I still haven't made an appointment yet.
Sounds like you're thinking about it.
Look, I don't think I need it. All right, but my girlfriend wants me to get it. So
What's Aaron's disposition? Is he an acceptor, cautious acceptor, hesitant, or a refuser? He's hesitant. We see from their conversation that he was a refuser in their previous visit. However, we can tell from what he's saying that he could be open to considering it. We definitely want the opportunity to hear more.
All right. And now let's move on to step 2, use MI to talk it out. And for those of you who may not be familiar with motivational interviewing, it's a collaborative conversation style that strengthens a person's own motivation and commitment to change. And with MI, it's really a way of being versus doing. The focus of MI is to enhance motivation. It's not about taking action. And while taking action is our desired outcome, it can't be the focus of the conversation. And for those of you who aren't familiar with motivational interviewing, there are 4 basic MI skills known as ORs that we just want to take a moment to briefly cover. There are open questions, affirmations, reflections, and summaries. And with open questions, these are questions that require a longer response than just yes or no, or a single word response. It really encourages people to tell a story and provide a more thoughtful answer. And then with affirmations, we may want to take the opportunity to highlight a person's personal characteristics, their strengths or values or other behaviors and qualities, and use them to help engage them in the conversation, help them to feel supported, appreciated, and understood. As we know, in regular conversation, we don't often offer these affirmations, and they can feel really good. And then with reflections, it requires listening to a person's statements, so what the words they're using, as well as the meaning behind them. And then we want to offer back or reflect back what we're hearing from them. And, we use this to check in to see how accurate our sense of what they're saying is. And it also provides a nice mirror to people so that they can hear what they're saying in a different way. And so you might reflect back exactly some of the same words that they say. You might be highlighting some of them, or you might reflect back something that's more of a theme or meaning beneath what they are saying. And then finally, with summaries, summaries are statements. They may be a number of reflections that you're stringing together that you want to offer back to people. And this helps in, transitional areas in the conversation. You might want to refocus the conversation by using summaries, or you could use it also to really highlight, in this case, some of the benefits to vaccination for them. And regardless of the person's disposition as you're talking with them, we know that the most effective approach really involves partnership, acceptance, and evocation. And we're going to take a look at these one at a time, and starting with partnership. And so we know when you're developing a partnership, you want to lead with compassionate curiosity. And you might ask a question such as, how do you feel about getting the COVID-19 vaccine? And then you want to follow with active listening and use reflections to really demonstrate the understanding that you have from what they're saying. And so you might say something like, you have concerns about vaccine safety. You also want to show interest in hearing about their perspective by making a statement and asking a question like, I'd like to hear about your perspective. Will you share your thoughts with me? And then, of course, throughout your conversation, you want to foster and build trust and respect by acknowledging difference, navigating any language barriers, answering questions in simple and clear language, and then also use your body language to communicate compassion and safety. And once you've developed this sense of partnership, you want to maintain an approach of acceptance. We want to certainly communicate in these conversations that we don't judge people for their opinions, no matter how similar or different it may be to our own. So we might want to provide reflections that highlight those values and priorities that are aligned with vaccination. You might make some statements like being free to make your own choice is key to you, or you want the best for your family's health. And then you'll also want to affirm their strengths and resources that really support vaccine acceptance. And then finally, you can summarize the benefits to vaccination that you've heard from them. An example here is the pandemic has put a lot of pressure on you and your family. You want to see an end to it and you want to do your part. While you know the vaccine can help with this, you want to know that it's safe. And then once you've set up a foundation built up of partnership and acceptance, you'll want to use other motivational interviewing strategies to evoke motivation. And one of the first that we would want to talk about is elicit, provide, elicit. And this is a strategy that you would use whenever you're wanting to share information. And so the first elicit helps you to find out what they really know. And you might ask a question like, what do you know about the development of the COVID-19 vaccine? And after you listen to what they've shared, or what they want to share with you, you want to ask for permission to share your own information by saying something like, would you like me to share what I know? And then you want to provide the information that you know. And then the second elicit refers to asking for their understanding, response, or interpretation of the information you shared. And this sounds like, what are your thoughts about this information? And then the other strategy you'll want to use is really supporting a person's choice and autonomy. Freedom of choice, in particular with these conversations, is the most important message that you really want to communicate throughout your conversation. And so you might say something like, it's your choice. Only you can decide what's best for you. What do you want to do now?
Please make sure you're muted.
And then in our video, we'll see some effective messages. And some of these are listed here. One of the first is being able to provide reassurance about vaccine safety and effectiveness, offer information about vaccine development, and then also share your own vaccination experience. I think the personal experience, I know when I've shared that information with the people that I work with, it's been very powerful because they're hearing something that's personal to me, and that's something that they can really relate to. All right, now let's take a look at what these MI skills and strategies look like in our video. So I'll share the video again.
So your worry about COVID has you so stressed out, and you want more than anything for you and your family to be protected.
Exactly. But you can't do it today, right? I know I have to wait for my turn, get on a list or something, or go somewhere else. Who knows where?
The obstacles feel big despite your desire and best intentions to protect yourself.
Yes, and I'm only one person. That's what I tell my husband. And it's not his fault that I'm stressed out. He lost his job as a cook about 8 months ago when the restaurant closed. And now he's home taking care of the kids, and I'm the only one working.
I'm so sorry to hear that your husband lost his job. You are both so stressed, and still you work together doing your best to provide for the kids. It's impressive.
We're doing the best we can.
I hear that. Regarding your added stress, you are not alone. So many of my patients tell me that they are anxious and worried. Like you, they just want to be vaccinated so that this pandemic can be over and we can all go back to normal.
Amen. I just want my husband to get back to work and for the kids to go back to school. And I don't want to work overtime every day to make ends meet or to go to bed so worried that we're all going to get sick.
So it sounds like you are ready to be vaccinated, more than ready. In fact, you would do it right now if we had access to the vaccine in our clinic. Your main issues with getting vaccinated are practical ones, like finding the time to locate sites that have the vaccine, make an appointment, and getting the vaccine without having to travel for hours or miss a day of work. It seems to me that if we can help you with some of those issues, you would be happily vaccinated. Am I getting that right?
Yes, definitely. If someone could help, that would be great.
Did you notice how she used open-ended questions, reflections, and affirmations to develop a sense of trust and partnership? With the space to talk through her stress, we see that much of Teresa's stress is related to COVID, and getting the vaccine could reduce some of her concerns. She's worried about her safety and the safety of her family. Without her own car, she struggles to get around on the bus. This adds an extra layer of difficulty for her to get to her appointments. And as the sole provider in her household right now, it's hard for her to take time off work to get her vaccination. We see that she's open to vaccination if some of these obstacles could be removed. Did you see how Dr. Kelly normalized Teresa's experience of feeling anxious and worried, and how getting vaccinated can help everyone get back to normal? Think about the MI skills and strategies you currently use and could incorporate into vaccine conversations. Now, let's see what's going on with Cal.
Tell me more.
Yeah, well, I'm not convinced that any of these vaccines are safe. I mean, they were created almost overnight, right?
That's a valid concern, Cal. And to be perfectly honest, I had the same concern when I first learned that the vaccines were being released. I reviewed the data very closely, just like you.
And
Well, though it may seem like these vaccines were developed very quickly, in fact, the coronavirus, which causes COVID-19, is similar to other coronavirus strains that have been around for a long time. Researchers had already been studying these viruses. So the COVID-19 vaccine did not start from scratch. Beyond that, every possible resource was put into the development of these vaccines. Money and regulatory approval were available, and the vaccine technology already existed. And all vaccines must be proven safe and effective before they are given to people. The COVID-19 vaccine is no exception. Beyond the studies, the vaccines are being proven safe every day as millions of Coloradans have already taken them. And nationally, many more millions have also received the vaccine.
so that means you got one yourself.
Oh, I did. I got vaccinated as soon as it was available to me. And I recommend that all my eligible patients consider getting vaccinated. In fact, my 93-year-old grandmother has gotten both shots. What do you think about the information I've shared with you?
That all sounds good, but I still don't know. You say that African Americans are at higher risk of getting really sick or dying from COVID, and that's pretty scary. But this country, and especially medical research, has not always been good to brothers like me. You know what I'm saying? I just don't want to be the first in line for a new medicine.
You know the history and you want to be sure of the safety of a treatment before you take it.
Yeah, it's not just historical though. Right now, today, lots of Black folks are not getting good health care.
It's not an old story, something that happened in the past. Healthcare inequality is still very real today.
Yeah, it shouldn't be that way.
No, it shouldn't be that way. You know, I appreciate how thoughtfully you are working through this decision. What other questions do you have for me?
I like it that you're straight with me, but I guess it would help to know that enough Black people were included in the studies and that it's just as safe for us too.
I can see why that would be very concerning to you, Cal, and I have some information that might ease your mind. May I share it with you?
Please do.
Well, I can tell you that African Americans represent about 13% of the population in the US and 10% of the study participants in the Pfizer and Moderna studies. It's not perfect, but it's a pretty good representation. The vaccines were proven safe and effective for all the participants, regardless of race or ethnicity. What do you think about that?
Okay, well, that's good to know.
I'm curious, Cal, beyond the safety concerns, what personal benefits, if any, do you see from getting vaccinated?
Well, from the beginning, my biggest worry has been catching COVID and bringing it home to my ex-wife and daughter. My little girl, she has CP and she's confined to a wheelchair. And my ex is her primary caregiver. So if anything happened to either one of them, I'd feel awful. And if my ex got COVID, honestly, I don't know how we'd care for my daughter. Of course, my ex is now vaccinated, so maybe there's a little less concern. But still, the thought of one of them getting sick, it's weighed heavy on me the entire year.
You love your daughter and you want to protect her. Protecting her has been your biggest priority this year.
Yes, she's more important to me than anything in the world.
And it's equally important to you that your ex stay healthy also so that she's able to care for your daughter.
Yeah, we've all been working hard to keep COVID away. And if the vaccines were safe, I guess that would be the obvious next step. But from my perspective, it's still a big if.
Okay, I think I understand where you stand. You've talked of your concerns about safety of the vaccines, especially in light of the rapid development timeline, as well as specific concerns for yourself as an African-American man. With the caveat that we don't yet know the safety long-term of these vaccines, the data so far indicate that they are safe and effective for most adults. You feel that getting the vaccine would be the logical next step after working so hard to make sure that everyone was safe this past year. And yet at the same time, it's equally important to you that you make an informed decision.
I may not be one of the first to get vaccinated, but I'll eventually do it. I just need to know that it's safe.
You might not be the first to get the vaccine, but you won't be the last.
Yeah, you got it.
Did you notice how Dr. Kelly used open-ended questions and reflections to understand Cal's perspective? She used self-disclosure to align herself with him. We see that Cal's primary concern is the speed with which the vaccines were developed. He wonders about vaccine safety. Here, Dr. Kelly is transparent and honest about what we know and don't know about the vaccine. Cal's also hesitant given the history of how Black people have been treated by the healthcare industry. He's very aware of the inequities in healthcare today. At this point, Dr. Kelly is empathic and uses reflective listening to express her desire to understand his experience. Primarily, Cal's concern is about his health and its impact on the health of his daughter and ex-wife. Notice how Dr. Kelly highlights his value of keeping his family protected from COVID. When it comes to specific questions, Dr. Kelly focuses on responding only to his question without adding any other information. She also asks for permission to provide information, which demonstrates respect for Cal's autonomy. Now let's take a look at what's going on with Aaron,
I think I told you last time that I was in that I've already had COVID. And since I was sick for a day or two, I'm pretty sure I have antibodies. So don't really see the point in getting vaccinated at this point, you know?
You can't see any benefit from getting vaccinated since you're fully protected already.
Okay, well, maybe not fully protected. I mean, life's risky, right? People get sick. I mean, I got it. Wasn't the end of the world. I mean, look, here I am talking with you about my asthma, just like last year, just like every year.
It's the same as it's always been for you.
In some ways, yeah.
You also said that you're not fully protected. What does that mean for you?
Well, just that even though I've already had COVID, means I can still get it again. And I guess I can pass it to others.
Yes, it's rare, but reinfections do happen.
Yeah, see, that's the part that gets me, you know, passing it.
Your community was hit hard, I know.
Yeah. Yeah, the construction jobs I do are mainly in residential facilities. They had a couple big outbreaks this fall. And that's where I got the virus in the first place. You know, me, a bunch of the residents, and like half the facility staff.
So sorry that happened, Aaron. It sounds like it was a tough time for everyone.
Well, my coworkers did fine. I mean, half of them wouldn't even know they had COVID if they didn't get tested. And for me, like I said, I was only down for a day or two. It's just like it was a bad cold. But for some of those residents who live in the facility, they died. That was pretty sad.
You feel bad about what happened to them.
And my girlfriend's grandma, I mean, she wasn't even in the facility and she was already sick with a bunch of other ailments, but she died after she got COVID. I mean, that's the thing, you know, before Amy's grandma died, like we used to joke about all the COVID hype. Like, yes, sick and old people died, but for the rest of us, I mean, for most people, it just wasn't a big deal.
You didn't see it as a serious thing since you and your friends can't die from it.
Exactly. You know, and a big part of me still feels that way. But not Amy. No, she's now on a mission to get everybody vaccinated.
She really wants you to get the vaccine.
Yeah.
And that's why your thoughts have changed a bit.
Look, Amy's amazing, right? And her heart's in the right place. But she's still reeling from the death of her grandma. And I just want to support her.
And getting vaccinated is one way that you can show her you understand and care.
Yeah, that's it.
Are there any other reasons for getting vaccinated?
Honestly, no. I mean, I don't think I'd be doing it otherwise. And most of my friends feel the same way.
Well, I just want you to know that I am very moved by your support for your girlfriend. It's a special thing. Okay, so let's see where we are on this. You said during our last visit that you wouldn't get vaccinated even if a vaccine were available to you. And a part of you still feels it isn't necessary. On the other hand, your community saw a lot of loss because of COVID-19, and you feel sad about that. But perhaps saddest of all is the loss of Amy's grandma. And now Amy wants you to get vaccinated, and you care deeply for her and you want to support her in any way you can. Did I miss anything?
Yeah, that's about it.
In this segment, we see Dr. Kelly accepting Aaron's perspective, even though it is different from her own. She doesn't challenge him to try to see things differently. She strategically uses reflections to evoke motivation, such as when she overshoots and reflects back to him, "You feel fully protected already, and there's no benefit to getting vaccinated." Did you notice how Aaron self-corrects and makes his own case for vaccination? Dr. Kelly focuses on what is really important to Aaron, which is his relationship with his girlfriend and his desire to support her. In her summary, Dr. Kelly starts with the reasons Aaron doesn't believe he needs to be vaccinated and ends on the side of vaccination and its connection to his core value.
Okay. And so now by step 3, make a plan. You'll have a good sense of where the person stands on getting vaccinated. And you'll want to ask a question like, now that we have talked about the vaccine, what do you want to do? And if the person is open to accepting the vaccine, all you need to do is support them to take steps to get the vaccine. For people who still want to think about it, you want to offer statements of autonomy support or affirmation, such as, "You'll know what's right for you." And if a person remains vaccine hesitant or refusing, let them know that you want to continue with the dialogue. And you might say something like, "Let's continue to talk about the COVID-19 vaccine. Is it okay with you if I bring it up the next time we talk?" This way, you can really keep the conversational door open. And now let's take a look at what this looks like in our video.
So you'd like help to get the vaccine. Well, let's see how we can support you getting the vaccine without causing more stress.
Okay, that sounds great.
We have 2 patient navigators in this clinic who have been working with some of our patients to get the vaccine. I can have one of them contact you directly to assess your needs and connect you with resources, including transportation, if you have to travel to a site.
That's amazing. I would be happy to talk to them.
And I know you're very busy. What would be a good time for one of them to reach you?
The afternoon is best, after 3 o'clock. My shift starts early and it takes me an hour to get back home.
All right, I'll have the patient navigator reach out to you tomorrow after 3 p.m. And she may also be able to help arrange transportation to our clinic visits so you don't have to take the bus anymore.
Oh, thank you.
Okay, let's take a look at those test results.
Okay.
Since Teresa's primary obstacle is transportation, Dr. Kelly connects her with a patient navigator who will be able to help her with transportation. In your clinic, who are the people that can provide this kind of support to someone like Teresa? If there is no one who can provide this kind of support, you'll need to work with your patient to find other resources in their community. In this type of case, be sure there is follow-up to ensure that the patient is able to connect to the resources discussed.
So, where are we now? What would you like to do?
I guess I'll think about it a little more and talk with some of my friends who've already gotten the vaccine to see how they handled it.
That sounds like a good start, Cal. I'll support you in making the best decision for you and your family, but ultimately, it's a decision that only you can make. What I can do is to continue to monitor the data closely and be honest about what we know and what we don't know. Feel free to call my office with any additional questions.
Thanks, Dr. Kelly. I really appreciate that.
Of course, and since this is so important to both of us, would it be all right by you if I bring it up during our next visit?
If I haven't already gotten my shot, we can talk about it again.
All right, let's take a look at these blood pressure concerns.
Cal needs more time to think about what he wants to do. Dr. Kelly offers an autonomy support statement to communicate clearly with him that he is in control and the decision is his. Then she asks him, "Is it all right by you if I bring it up again in our next visit?" Through this question, Dr. Kelly keeps the conversational door open with Cal, setting them up for a follow-up conversation the next time they meet.
So what's next for you?
Yeah, I think I'm just gonna go ahead and get vaccinated. I mean, it's not like it costs anything, you know?
I'm really glad you came to a decision. And it does seem like the best one for you. And you know where I stand. The sooner we can get the majority of people vaccinated, the sooner we can all get back to a normal life. We all want to be together again. That's why I got vaccinated as soon as it was available to me. So what support or resources, if any, do you need to get your vaccine?
I don't think I need anything. Amy's already got me signed up. I just need to confirm the appointment.
Oh, so you'll be sure to get an appointment in the next couple days.
Knowing Amy, it'll probably be tomorrow. I do have one question for you though, Doc.
Yeah, what's up?
How long is this vaccine supposed to be effective?
We don't yet know how long the protection will last for those that have been vaccinated. There is a possibility of a booster shot, but only time will tell.
Life's risky, right?
Indeed, it is. We make informed decisions based on the knowledge we have. I'm happy you were able to make an informed decision today. And if it's all right with you, I'd like to check in with you about this during our next visit.
Yeah, sure, if you want, Doc. But I'm pretty sure I'll be vaccinated by the next time I come in. Amy will make sure of that.
This is an example of how someone can change their disposition. Aaron refused vaccination in a previous visit and now states that he is open to getting it. As you can see, there is power of persuasion within every community. And for Aaron, it's the influence of his girlfriend, Amy, that has changed his view. Even so, this conversation with Dr. Kelly reinforces his new stance, and their planning ensures he will follow through with vaccination.
All right. So now that we've reviewed the 3 steps to vaccine acceptance, let's revisit the flowchart you saw earlier briefly. So you'll want to start with assessing disposition, and depending on their disposition, you'll take different actions. For an acceptor, you'll help arrange for vaccination. For a cautious acceptor, you will approach with curiosity, answer any questions, and then help arrange for vaccination. With someone who is hesitant or a refuser, you will, of course, again, want to approach with curiosity, answer any questions, use your MI skills and strategies to evoke motivation, and then reassess. Then you can either help arrange for vaccination or you can arrange for follow-up to keep that conversational door open. We've developed a brief that details all the information we've shared with you in the training today. You can follow the link here. We'll put it in the chat, and you can download the Protect Me, You, Us brief. And from the same link, you can access the Protect Me, You, Us video, some of which you saw today, which is 30 minutes, the complete video. Or for folks who don't have that much time in one sitting, it's broken up into the 3 different steps. Just a reminder that these resources are intended for healthcare providers or those in the community who work with people who are vaccine hesitant. They're not intended for patients or clients. So our goal here is for you to use these skills and strategies to have more effective conversations with your vaccine hesitant patients. All right.
Okay, so I'm going to go ahead and stop my share. Here's our contact information if you want to reach out to us with any questions.
1, 2, and 114 saved messages.
And then just want to open it up before we finish today, just to see if there's any comments that anyone would like to make.
Also, we've put a training evaluation link in the chat, and it's very brief. If you could please take just a minute to fill that out, it really helps inform our future trainings. Thank you.
Yes. I like to say something.
Please, Keith.
So, what I would say, one, is that it's very unique that you have someone that meets the social determinants and a lot of the market segments, and myself, and different hats in terms of stakeholder interests. Being that I've seen service providers through vaccination, my peers actually steward, initiate, and they're actually doing. I also have peers that understand that there's a history of health equity advocacy in Colorado that started almost about 10 years ago. And although we were not initially involved in the initial stages of the process, we still remain somehow able to be present. And so me being and listening today, understanding that one, I want to support this effort. Why? Because I don't think there's any other efforts that are doing so. But yet and still, when I look at the efforts, I would never criticize the efforts. I would just share when we'll put it on the melon. So when you share from the perspective of having a melon account that I have, and then you say, okay, well, trust and the processes of listening that you all advocated. And I personally experienced the hesitancy, visceral outright, I'm not going to do it at all. But again, because my peer group started one of the first vaccination centers in Colorado, well, was one of the first waves, I'll put it that way. I got to watch them. I had to say, okay, I'll help you set up, just watch this process. And when we met with members of CEPHE and engaged with them, eventually I went from, I'm not going to do it, I'll let other people come along, see if people don't die. If they don't die, then I'll do it, to actually doing it. And the same process of just the conversation dynamics, listening, being empathetic, being able to identify and relate, but using, I think the one thing that I fell on today was using the testimony or the element of just letting the person just share their voice, similar to what I'm doing now. And then once they talk it, they can hear themselves, and you have kind of like a conversation going on with somebody who's just saying, hey, I just want to be a voice that hears your voice. I want to be the ears that hears your voice. And as they talk it through a couple times, they do come to conclusion. Now, when it comes to collecting the data, and right now there's data collectors out there for COVID, and everything is well intended. But when you get down to the authenticity of truth and getting people to honestly share the truth, that's the difference between getting the actual results and taking that data and looking at behavior as far as being predictable. I say that because on the one hand, I want to be real critical, because I know what it's like to be around Europeans and white folks who have taken the speed of trust as a body of work. I spent the last 10, 15 years trying to engage people with melanin to learn the body of work called the speed of trust. Because the most successful leaders, organizations, families that are using that universal laws to predict behavior without results. So we got the right idea, but just like on this call, I don't see any brothers on the call. So I have to make sure that I advocate for some brothers to get on these kind of calls, one. And then two, how do I get them to see it the way I see it? I don't. I just get them to see it. And a lot of things that they'll share with me based on our shared experiences still add up to, well, can we be truthful? Well, it costs. Why? Because there was a lot of trauma. I'm gonna stop now, because what I did was to share, rounded off a bunch of insights and observations, but I just want to let it be known that this work matters, and the more that you have people with a higher melanin count involved at the initial stakeholder, decision maker, where the resources are determined and the metrics to reach that level, the more that you have folks, and you have to have folks like myself who says, no, that he just looks like that, or she just looks like that. That's not who they are.
Yeah.
And the experience we can relate to is the plantation. Moms and the dads, and ask anybody, you have a lineage where your people came off the plantation. Those are the people. I'll leave you all with one last piece of a solution. It's ironic. and it's called The Closer. If you don't know, comedian David Chappelle, who's a healer, is getting in all kinds of trouble. But I think that if you would go back and look at his body of work, he did an 8-piece on Netflix. His last one is called The Closer. And so to be able to get you all to relate to what I'm speaking to, he best illustrates that. He uses humor, he speaks to humanity, spirituality, all those pieces that it's going to take outside of scientific aspects of what we're doing. Thank you for allowing me to share. Thank you for inviting me to this presentation.
Thank you so much, Keith, for sharing your observations and perspective. I really appreciate it.
Absolutely.
Is there anything else anyone has before we finish up today?
I have a question. Will we be provided the recording of this session? Because I work for Alliance for Aging, and this is the very question that I had a couple of my colleagues asking, how they can use this type of reasoning to talk to different folks about, being more readily prepared to take on the vaccine. So I appreciated everything. I think it was well done, very well put together. I really appreciated the mock interviews. Thank you.
Thank you so much. And were you asking about whether or not this was being recorded?
Yes.
Yes, so we're recording it, and then I'm not exactly sure how we'll be sharing it with those of you who have signed up, but you should be receiving that. So a link that we'll send.
Thank you. Even if it's not recorded, even parts of the PowerPoint. But I definitely will go in and view the videos, and I can share that with my team. So I really appreciate it. Thank you so much.
Yes, you're welcome. Anything else? Well, thank you so much for joining us today and for all of the work that you all do out in the community. We certainly know that it's not easy to have these conversations, and it takes a lot of authenticity, as Keith was mentioning, and really showing up and engaging with people about their concerns. And so thank you again. Have a wonderful rest of your day.
Thanks all for joining us today. We appreciate it and hope you have some takeaways that will serve you immediately in your work. We thank you for your work.